Hi everyone, and welcome to TS Fibro. Today's video is going to be on chest pain and fibromyalgia. I hope everyone's enjoying the videos. I'm going to try to get a few more out. If you have any particular symptom that you would like me to do a video on, just let me know in the chat below and I'll look at it. Okay, chest pain and fibromyalgia. If you have fibromyalgia, you may have noticed that you often feel intense pain in your rib cage and chest. This aching and stabbing pain is very common in fibromyalgia and can really impact on your enjoyment of life. If your chest pains are making it difficult for you to complete your work, get a good night's sleep, or even breathe deeply, it is important to visit with your doctor. No matter what, if you're starting to get chest pains and you're thinking it's fibromyalgia, please go to your doctor and make sure that it's not something else. Chest pain and fibromyalgia is usually nothing to worry about, but occasionally it can indicate other problems, so always consult your doctor. Costochondritis, a painful problem. The chest pain associated with fibromyalgia is referred to as costochondritis. It is an inflammation of the cartilage that joins the ribs to the chest bone. It is this inflammation that causes the sharp chest pains inside the chest wall. The pain of costochondritis often mimics the pain of cardiac problems, including heart attacks and stroke. This can be quite scary for some sufferers. However, costochondritis rarely causes any physical complications. Costochondritis affects about 60 to 70% of fibromyalgia sufferers. Costochondritis in women is particularly common, especially in women between the ages of 20 and 40. Costochondritis, rib pain, can last for weeks and even months, and can reappear at different intervals throughout your illness. Costochondritis can also affect those who don't have fibromyalgia and is often a result of chest trauma or exercise-related injury. In fact, it is thought that about 10% of the general population has costochondritis. Where does costochondritis hit? Costochondritis affects the junction between the ribs and the chest bone, also called the sternum. 7 bits of cartilage attach your ribs to your sternum, and costochondritis causes the cartilage to become inflamed and sore. If you have costochondritis, you will be able to feel pain upon movement of your upper torso or when you touch your ribs. Most commonly, pain is felt on the left side of the chest, though chest pains on the right side, or even both sides, can occur. Any one of the 7 cartilage junction points can be affected by costochondritis. 90% of people with costochondritis suffer from more than just one inflamed cartilage junction point. In severe costochondritis, all 7 cartilage junction points can be inflamed. This inflammation causes pain on the anterior, the front, chest wall, which can be felt when you move and when you palpate your ribs. Typically, the 2nd to 5th ribs are affected, though it is also common for the 6th rib to be affected. What does costochondritis pain feel like? Costochondritis pain is often described as a stabbing or aching pain in the ribs. This pain can come and go. Some days it will be worse, while other days it will be much better. The sharp pain caused by costochondritis generally begins in the chest. This pain can then radiate outwards, attacking the shoulders, neck, and upper abdomen. Costochondritis pain can last for long periods of time, and chronic costochondritis is not uncommon. However, most pain should be gone within 6 months to a year from the onset of the symptoms. Symptoms of costochondritis. If you have fibromyalgia, be on the lookout for these costochondritis symptoms: sharp, stabbing pain in the front of the chest, ribs that are sore to touch, pain on the left or right side of the chest, upper chest pains, burning pain in the ribs, pain that radiates up the back of the neck and shoulders, pain in your chest when you sneeze or cough, pain that increases with activity, exertion, or deep breathing, pain that decreases with rest, movement, or slow breathing. Costochondritis is also associated with other secondary symptoms. These include rapid heart rate, irregular heart rate, shortness of breath, or difficulty breathing. If you are experiencing any of these symptoms, it is important to visit your doctor in order to rule out other complications. Always go to your doctor and get checked out. Causes of costochondritis in fibromyalgia. To date, the specific cause of this illness are unknown, though researchers do believe that a variety of factors could play a role in the development of the illness. Repetitive activity responsible for the chest pain suffered by people with fibromyalgia. Sitting at a desk or leaning forward over a computer for long periods of time often puts stress on the muscles in the chest. People with fibromyalgia already have hypersensitive muscles, and this repetitive activity may exacerbate pain in the chest area, causing costochondritis. Fibromyalgia tender points. The tender points present in fibromyalgia may be responsible for causing the costochondritis in fibromyalgia sufferers. Tender points are located just to the left of the chest, underneath the collarbone. These tender points may be causing intense pain in the chest region. Myofascial pain. Many fibromyalgia sufferers also have myofascial pain syndrome, an illness that causes the appearance of painful trigger points throughout the body. Costochondritis may be the result of the trigger point that have developed in the rib area. Infection. Rarely, costochondritis can be caused by upper respiratory tract infections or non-allergic bronchitis. This condition can cause long periods of repetitive coughing. This coughing can stress and strain the cartilage that connects the ribs with the sternum, causing constant chest pain. Effects of costochondritis on fibromyalgia. Costochondritis can exacerbate the symptoms of fibromyalgia. In particular, fibromyalgia often inhibits your ability to participate in certain activities or sit in certain positions for long periods. Because costochondritis causes such intense chest pain, it often makes sleeping difficult or impossible, causing disordered sleeping and insomnia. Costochondritis disability is not uncommon, especially in fibromyalgia. If you are experiencing any type of chest pain, it is important that you immediately consult your doctor in order to correctly diagnose the nature of the pain. Okay, so if anyone is experiencing any kind of chest pain and you haven't been diagnosed for it or it's a new symptom for you, please go to your doctor. Get anything serious ruled out. Fibromyalgia is painful. It's frustrating. It's exhausting, but it won't kill you. So you need to make sure that the chest pain doesn't have anything to do with your heart. So please don't just assume that your chest pain or your rib pain is caused from fibromyalgia. If you haven't had it before, you haven't been diagnosed with fibromyalgia, or you have been diagnosed with fibromyalgia and this is a new symptom for you, please go to the doctor and get checked out. Well, I hope everyone enjoyed the video. If you did, please subscribe, hit that like button, and hit the notification bell on the side if you want to be notified when I put up a new video. I pray for a cure, and I pray you have a pain-free day. God bless everyone.